Hi, everyone. My name is Ilian Abouassi. I'm from the American Autism Association. We're just going to give it another minute or two to let some people join, and then we will begin. Thank you all for joining us today. We noticed that in the registration, quite a few people were joining from different areas from all over the world, and we'd love to know where you're coming from. So before we start, if in the chat you'd like to put where you're joining us from, we'd love to know. I'm in a very rainy New York today. North Carolina, Boston, welcome. Alabama, California, welcome, welcome. Okay, so we're just gonna move forward and get started. I'd like to thank everyone for joining us today for our virtual parenting workshop on behavior and learning during COVID-19. As a part of our efforts to continue the work that we do through COVID and switch to a virtual platform, we started doing virtual parenting workshops and have partnered with a number of different organizations and centers. Today, we're very grateful to be working with the Child Mind Institute in New York. And this is, as I said, is a part of the work that we're doing to try and pivot to working virtually and serving our community. For those of you that don't know and aren't familiar with the American Autism Association, we are a charity that helps families affected by autism, and we do this in a number of ways. First and foremost is through education and support. We have a number of educational resources on our website, and we also have an autism help hotline where families from all over the world can contact us with questions, concerns, or looking for resources in their area, and we'll help you find them. We additionally have parenting workshops, which we're obviously offering online. And then third, which is the largest area of our work, is our therapeutic recreational programs. So we have programs such as ballet, soccer, basketball, and they're all therapeutic and educational in nature, but also very fun for the families that we serve. That program has been put on hold for now, but we're still offering some fun virtual learning opportunities for kind of the recreational piece. We've done a cooking class, we've done ballet, and we're going to continue doing that work as well as everyone is staying at home. Which kind of leads us to the topic of today, whether you're going to be at home or not, which we'll delve into. Before we begin, I just wanted to do some housekeeping. I'd like to make sure that everyone's settings are set to speaker view so that when our presenter makes their screen large, that's what you see. We're also going to be keeping our attendees on mute, but feel free to add in any questions that you have in the chat function and we'll get to them. We'd like this to be as interactive as possible, so please do add in, information as we go through, as well as we'll be having a Q&A at the end of the session. So any questions that you have, we'll ask them at the end and welcome anything that you have, concerns about. We'd love to be able to discuss that and use this as a platform to answer the questions that you have. Lastly, we will be sending a recording out afterwards. So please, if you have to pop out at any time, know that you can come back to this, as well as all the resources that our presenter will be going through, we'll be sending to everyone. So please sit back and listen, and I'd like to pass it on to Dr. Cynthia Martin from the Child Mind Institute, who's going to be our presenter for today.
Hey, good morning. Thank you everyone for joining us. So it looks like we have people from across the country, and no New Yorkers here. So I'm also joining you from New York. I'm here in the city. And let me just get my screen. Oh, what did I do here? Here we go. Let me get my screen shared. No, my desktop. Hold on. Let me try that. There we go. All right. Okay. So I'm joining you from the Child Mind Institute. I'm a clinical psychologist who specializes in diagnosis and treatment and school consultation for children with autism spectrum disorder and related neurodevelopmental disabilities. I've been doing this for about 15 years now. So I'll be talking to you today about how to support the behavior and learning of your child with autism during this pandemic. So an outline of our workshop today I'm going to give you an introduction about the Child Mind Institute, who we are and what we do. I'll go over the effect that the COVID-19 pandemic has had on children with autism spectrum disorder based on some research that we've gathered thus far. Go over recommendations from the Centers for Disease Control and Prevention, or the CDC, as well as the American Academy of Pediatrics. And then we're going to delve into talking about the return to school. Returning to school is going to look very different this year. There are various learning models for the upcoming school year, so we'll talk about the differences in those and the ways to prepare your child for those different learning models. We're also going to talk about how to make the best use of your child's IEP. So if your child does not have an IEP, we can also talk about what they are entitled to in terms of getting an IEP, and then how you can use that to help your child appropriately access the curriculum during this pandemic. And then we're going to talk about some of the relevant aspects of the pandemic, things like wearing a mask, how to support your child's behavior across the various learning models at school and at home, continuing to build their social skills. And then I have a list of resources. So everything that I talk about today, if there's a specific area that you want to dive more into, I have links to videos that go more in depth to explain how to support your child in that particular area, as well as links to things like masks, social stories for masks, and links to various websites that you can connect with for clinical services if you need additional help in supporting your child in that area. And then we'll have time at the end to go over all of your questions and have some discussion. So actually, before we go back there. I see it looks like my poll disappeared. Could we get the poll, or if folks just want to put in the chat? I'm interested to know if your child has started school yet or not. There it is. All right. So we have some yeses, some nos. All right. 10. Okay, so it looks like we have the majority of families are saying that their child has not started school yet. So I'm going to share the results here. So we have one who has started school, and the majority have not. And that's the same, similar here in New York. School has not started yet, where there's a plan for school starting a little bit later in September, but no schools have actually started yet. Okay, and all right, so I'm coming, as I mentioned, from the Child Mind Institute. What we are an independent national nonprofit dedicated to transforming the lives of children and families who are struggling with mental health and learning disorders. We have a multidisciplinary team that works to provide high standards of clinical care, as well as to advance the science of understanding the brain and empowering parents. So we also have several funded research studies that are funded by the National Institute of Health. We work with professionals and policymakers to support children where they need it the most, and we do not accept any funding from the pharmaceutical industry. So let's talk about what are the effects of the pandemic on children with autism spectrum disorder. We know that children who have autism in their families have really been disproportionately affected by the COVID-19 pandemic. The research that's been done thus far to survey families is showing that most families are reporting that there has been a severe disruption in their children's services. This includes both their school-based services and their private after-school services. In services that have been transitioned to a telehealth model, the national surveys that were published in research available thus far is showing that the quality of telehealth and virtual services has been reported as being unsatisfactory by a significant portion of parents. Parents are reporting that they are seeing negative effects on their children's behavior due to the pandemic and the stay-at-home learning. And adults who have autism are reporting that they feel that their mental health has been compromised due to the COVID-19 pandemic and all of the restrictions and mandates that are associated with that. Our research director, Dr. Adriana DiMartino, is leading an initiative to survey families in the New York area, as well as she's working with a team of collaborators internationally to survey families across the country, across the country and internationally. And this is some preliminary data that we have from families in the New York area. So the majority of families are reporting that services either came to a halt or were transitioned and modified into a telehealth format. This includes both their private services as well as their services that are provided through the educational system. And out of services that were transition to a telehealth model, families in the New York region are reporting about a 20 to 50% rate of not being satisfied with those services. So feeling that those services are not as helpful as they were in person for their children. But within that 20 to 50% dissatisfaction rate, what it also tells us is that in some areas, there are 50 to 80% of families that are saying, actually, this telehealth model has been helpful in some ways for my child. So what that tells us is that although a telehealth model is not ideal in any sense for children with autism spectrum disorder, there may be some versions of telehealth oriented teaching methods and therapies that can be helpful for continuing to educate and teach children with autism the skills that they need help and support in. So let's talk a little bit about why this pandemic has been challenging for children with autism spectrum disorder. We know that autism comes on a spectrum, so one child is going to be very different from another child, and they're going to vary greatly in their symptoms and behavior, but we do still see some common themes that seem to be consistent across a significant portion of kids with autism. And these are what some of the commonalities are that we see that has affected them, that has led to them being more affected by the pandemic. So there are disruptions in their routine and structure. So we know that when a normal routine is suddenly and abruptly changed, it can be very upsetting and it can be difficult for parents to manage it. It can be difficult for parents to understand, or for parents to help their child understand why these changes are occurring. Some children who I see in my clinical practice, I received correspondence from their parents saying, I don't know how to explain to my child that they're not going to school. They're not physically going to school anymore. They get up in the morning, they put their backpack on and they wait by the door to go out and get the bus and are very upset that the bus doesn't come. So this is something that parents would commonly report in the past when they were transitioning from school during the week to just weekends, that it could be difficult for their children to understand those changes in routine. And so it's a similar type of disruption, but in a much more significant sense since the pandemic started. Also, it's difficult for parents to provide guidance to their children to know when will that in-person school resume. So, and those unknowns can be particularly challenging for children who have autism and really thrive on the structure and predictability in their day. Many children who have autism learn very well when they have a high level of supervision with hands-on support to complete their schoolwork. So we know that a lot of children who have autism are really great tactile learners. So the verbal learning can be more challenging in some aspects. So pairing verbal learning with other multisensory means of instruction really helps them to learn both academic and behavioral skills that help them be successful. With the onset of remote stay-at-home learning, that multisensory, more tactile-oriented way to learn was removed fairly abruptly. And it was really placed in the hands of parents who at the same time were having to work from home, which is quite challenging to be able to provide your child with 110% attention and to have to adopt specialized teaching methodologies that parents were not previously trained in all of a sudden, while also trying to balance the responsibilities of work, is pretty challenging and impossible. So the majority of families who have children with autism and were thrown into this very immediate stay-at-home learning, dual work situation reported high levels of stress. So if you felt very stressed over the spring into the summer and even now, know that you are not alone, and that's something that's being reported by families across the country. And reported because it is hard. There's really not a way to sugarcoat that. We know that some services also just cannot be easily adapted into a remote format. So services like physical therapy or occupational therapy that again require equipment, hands-on kind of approaches and materials, that's harder to do through a screen. And asking parents who are already at home working, having multiple kids to take care of, sending parents a list of materials that they need to prep before their child's virtual learning session is very challenging. And that puts a very high burden on the family at a time that stress is already very high. And then there are other kinds of services, therapeutic and recreational services, things like therapeutic ballet, horseback riding, swimming, karate, those kinds of programs that children with autism are just thriving in and love and look forward to and help them emotionally regulate and help them to have a really appropriate outlet for physical activity, all of a sudden stopped. And those are also not easily adapted into a virtual format. There is a way to do some of those virtually, but the effects that they have and the benefits that they have for children, there's just no comparison to in-person kinds of activities like that. So if you could put in the chat some of the challenges, what do you think has been the most challenging for your child and for your family? And if things have not been challenging too, you know, the majority of families are reporting some challenges, but I also, every now and then I come across a family who says, you know what, actually, this has been the best thing that's happened to my child. And now all of the stresses of school are removed from them and they like virtual learning. So if that's also been the case for your family, please also share that information, because that's also valuable. And then we'll take a look, and when we get to the end to go through our discussions and questions, we'll want to also, I want to look through that and talk about, see what some of the themes are there. So now thinking about the CDC and the American Academy of Pediatrics, both of those organizations are recommending and supporting the safe reopening of schools. And now I have safe really bolded and underlined, because that's the determining factor. And that's what a number of schools are having challenge with right now. So we know that in-person school is better. We know that the social emotional benefits and the learning benefits, we know that those are all better in person. However, we cannot compromise the safety of our children, especially vulnerable children who have learning differences and developmental differences. We cannot put them in a risky or unsafe situation. But we do need to continue to provide appropriate opportunities for learning for children. So now let's move into the learning models for the next year. So these are learning models that I will assume that everybody has heard of at this point. So I'm going to go through them, I'm going to introduce them quickly and then kind of go into more of the specifics about what do you need to have on your radar for preparing your child for one of those learning models in this next year. So there's the traditional in-school instruction. We know that this is going to look a little bit different this year, but there are some schools across the country that are really pushing for and trying for a 5-day reopening. So that would be going to school in your generally regular hours for in-person learning for the majority of the week. Then there's remote learning with virtual instruction. So this is when children are staying at home and then a teacher is available and providing curriculum and lesson plannings online. So they're using something like Google Classroom or Zoom or other platforms to teach the educational curriculum. Then there are the hybrid blended instruction. So this is when kids are going to school for a part of the week or maybe just a part of the month. Maybe they're going 2 to 3 times a month, or maybe they're going 2 to 3 times a week. And each school, how that looks for each school is really different depending on what the school's capacity is and how they can open in a safe way. So that is, but what it means is there's some level of in-person instruction in a traditional school setting combined with remote and virtual learning. So now let's see, let's put the poll up. I'm interested to hear what are your plans for your children this year? If you have a choice, have you made a choice of one of the learning models for this year? Or if you don't have a choice, what is your school offering? So let's see, it looks like we have a lot of remote, 75% coming in with remote. We have some hybrids, and we have a full in-person. All right, let me share. I'm going to share these. You can see, so we've got, looks like we have people across the board with these. The majority are remote. All right, 60% remote, 30% hybrid blended, and 10% in person. And then we know also that depending on where your state has set the threshold for infection rates, we know that that the schools are subject to closing at any point during the year. So in New York, for example, the infection rate is set at 3%. So if out of everybody being tested for COVID-19, if the positive test results go above 3% of that sample of individuals who are being tested, then all in-person instruction will be paused until infection rates are back down, and then schools may be allowed to reopen. So that's also something that any of the models that involve in-person instruction are also subject to over the next year. So when you are thinking about, if you have a choice in learning models, when you are thinking about which one do you want to choose, you really want to start with making a list of priorities for your family. So this is something that we know that there's really not a best in this situation. You really have, if you have the option for in-person or blended or remote, you really have two not great options to choose from, because there are going to be drawbacks no matter which one you pick. So in this situation, you want to think about what is going to work the best for your family. How are you going to make it through this year? Because you really want to focus on, let's get through. Eventually this pandemic is going to get better and things are going to move back towards a more normative educational model. But for the time being, we want to get through minimizing regression and trying to build as many skills as we can and as we can prioritize. So when you're thinking about what's realistic for your family and making a priority list, you want to think about how many adults do you have that are involved in your child's education and in their care, and how many kids do you have in the home, because that's going to be a driving factor on what's going to be realistic and feasible for your family. When you're thinking about virtual learning and remote learning types of instruction, is there going to be an adult available to facilitate your child's learning? We know that the majority of children are not going to be 100% independent in initiating and completing their schoolwork and in following a home learning schedule. You want to think about also, is the school offering asynchronous? So there's certain times that they're expected to be doing certain kinds of activities, or is it more of a learn at your own pace? And depending on which type is going to be used, how does that work for your family? Who's going to be available to help support your child through that? And then what do you need to manage while another adult is helping your child? Are there other children at home that are going to require childcare because they're not at the same age or academic level to be working on the same activities as your other child is? And then you want to think about, you want to also think about the health status of family members in your home. So who is anybody at a high risk for complications from a COVID-19 infection? The CDC publishes, as they have additional information about medical conditions that have a higher likelihood of having risks and complications from a COVID-19 infection, they publish those on their website. So that's something to look at regularly as it is updated, and talk to your healthcare providers about it to know, is there somebody at home that is at risk that kind of is going to take priority in terms of this decision making and maybe drive you pretty quickly into a fully remote learning environment. Then let's see, the other thing you want to think about then is what do you want your child to learn and gain over this year? So we really want to prevent regressions in skills. So that's one thing I would think about. What has your child made progress on thus far? That what skills do we really need to maintain? And then what are one or two other academic skills that you really want to make sure that your child learns this year? So whether that's learning, working on their reading skills or their fluency or their writing skills or some of their math skills, what's a specific skill in that area that you want to make sure that your child has mastered over this next year? And then if your child receives, and you want to also think about if your child is on a regular education curriculum or if they receive a modified special education curriculum. And if they're on a regular education curriculum, you can look up the Common Core standards. If you just Google Common Core standards and then look at your child's grade, the Common Core standards are on a federal Department of Education website. It's broken down by grade in terms of what is expected for each grade and the entry into the next grade. Take a look at those and think about what do you want to prioritize in your child mastering? And if your child is on a modified educational curriculum, use that list to talk to their special education team to understand what is expected of your child in this next year. What are realistic, reasonable expectations to have for them in terms of learning over the next year? Because every child should continue to maintain skills that they've previously acquired and make some academic gains in the next year. And I understand with the pandemic, we may not be able to have the same learning expectations as we do in non-pandemic times, but that doesn't mean that we shouldn't have any expectations. So make a list of that. Then use that list when you're thinking about the health, the logistics of your family and work-life balance, and academic goals and priorities for your child. Use that list to guide your decision making. And again, knowing that most families are going to feel like there's really no good choice because no choice is going to be perfect and there are going to be significant limitations to each one. But you want to think about how to use those for the next year and know that what might work for your family might not work for another family. And that's something that I hear a lot from families where they've made one decision that works well for them and then they feel judged or ridiculed by another family who does not support that decision. So I think we have to know that during this next year, it is just going to be really different for each family. And okay, so now let's talk about preparing your child for each of these learning models. So if your child is going back to in-person traditional instruction, they are going to encounter many changes. School is not going to look like it usually does. And it is good to let your child know that ahead of time so that you can prepare them as much as possible and they're not surprised. So what are some of the changes going to be? There are going to be physical changes to the school and the classroom. There may be one-way hallways. They may not walk to their classroom in the same way they did before. There may be staggered drop-offs and pickups. If you previously dropped your child off in the classroom, you may no longer be allowed into the building. So that drop-off routine may be quite different. You might drop them off with a teacher who then walks them to the classroom, a teacher or somebody working for the school. There are likely going to be changes to busing. You know, some districts are deciding just not to provide busing, and that's a very significant change. Children who really look forward to riding the bus and have had established relationships with their bus drivers, knowing that that's not going to happen this year, can be quite a challenge. Lunch in many schools is going to be in the classroom now. So kids who are used to that change in routine and scenery of going from their classroom to a cafeteria or another lunch area, that's something that's going to be different. And there may be changes to specials. So art, music, gym, they may be in the classroom, they may be not provided as a way to cut down on the time that kids are in school for in-person. So that's something that you want to understand from your individual school. Are those specials going to be provided still? And if they are, what are they going to look like? Then a big piece is the physical distancing. So as somebody who works with children who have autism and neurodevelopmental disabilities and learning differences, I'm used to being really hands-on with kids. You know, when they come to see me, they may run up and give me a big hug. And I see kids who are, you know, 8, 9 years old now, and I've known them since they were toddlers. So we have a close relationship, and they really look forward to coming into their visits. And I think that's echoed by special education teachers as well, who have established really close relationships with their students. And that kind of being kind of close to them physically is something that is not going to be recommended this year. And that is a change and a shift in something that will require a skill to be taught, so that children understand why those differences are in place and how you can show the positivity that you have in that relationship in a different way. So what I do with kids now is I teach them, we talk about COVID times. So I tell them we have to do the COVID fives. So we do elbow fives and things like that. And we talk about how that's really just something we're doing during COVID times. And we're doing that to keep each other safe and to keep everybody healthy. Another big piece is needing to wear a mask. So that's something that is happening in schools. It's happening in community-based centers, in medical clinics. Needing to wear a mask is a big topic right now, and something that will be part for most schools in the return to school. And then there may be temperature checks. You may be checking your temperature. You may need to check your child's temperature before they go to school in the morning. There may be temperature checks at the school before they go in. And that's something that you'll want to be aware of before that happens, so that you can prepare your child. And then at schools, there may also be hand washing stations. So there's going to be a greater focus on making sure that hands are washed and that hands are washed regularly. And so if your child doesn't like to wash their hands, you know, if that's not a pleasant experience for them, that'll be an area to work on. And if it's something actually they really love because the water is fun and exciting, it might also be something that there needs to be some teaching around, so that the washing stations do not become a distraction. Then when we're thinking about remote learning, the big thing is we've got to make sure, you know, kids need to have the equipment and the Wi-Fi and internet connection. And this is something that if it's not available in your home, talk to your school so that they can get you the equipment that you need. They can get an internet hotspot so that your child is connected. And because if they're not connected, they're not going to be able to appropriately access the curriculum. With using devices, of course, you know, kids are kids. If you hand a child, you know, an iPad, they're smart. They want to go and do the thing they want to do. Let's get on YouTube. Let's go see Ryan's World. Let's go on PBS Kids and play some games. Who wants to sit there and listen to somebody trying to teach them something? So those are things, obviously, I'm sure that everybody is aware of, and just thinking about how you can proactively put parental controls on the devices, or have a device that is only for school so that other more fun kinds of activities are disabled, will be something that's important to help kids, again, be able to access the learning that's being provided to them. There are lots of softwares that are going to need to be installed and access to login information. I will have to say, I was somebody who really preferred in-person, hands-on everything in everything that I did before this, and having so many softwares and logins and things, for me as a professional adult is a lot. So it has got to be really heavy for children, and especially for parents who are trying to balance that on top of doing other things. So making sure, you know, if the school can help with getting things set up and just making it as easy as possible for families, that's something that'll be also important to ask and advocate for. Then there's the physical space. So most kids are not used to school being at home. Home is their respite. It's where they get to do, where they're the most comfortable, and they get to do what they want to do when they want to do it. So having to now jump into school mode isn't that accepted by all children. So thinking about how can you make a dedicated physical space to where learning is going to happen, by having a desk, a comfortable desk, or a comfortable seating arrangement for them, so that can kind of help prompt that, all right, when we're here, this is really school time, and it can help improve their attention and focus on what they have to do. Then I'm having a daily schedule and expectations. So one, you'll want to work with your child's educational providers to understand what are the expectations. So what's expected from the child in the day? Are they supposed to, is there a list of activities, a list of tasks that need to be completed? Are there going to be certain times that they need to be available for a morning meeting or for one-on-one reading support with a reading specialist or with a special education teacher? What are the expectations, both for those kinds of face-to-face times, as well as for what should the child be doing outside of those structured face-to-face sessions? You really want to know, this kind of goes to what I was saying before about self-paced versus teacher-led or a combination. And then how's the school going to provide the related services in a remote learning paradigm? So kids who have paras, how are those paras, are they supposed to just call the parent in the morning and give them 15 minutes of non-specific instruction that checks a box to say that they did it? Or is that para going to be available to the child in the same number of hours that they were before COVID happened? So is the para going to be available when group-based learning is happening, and then work with the child one-on-one afterwards to make sure that they learned the concepts that were being taught? And speech, OT counseling, ABA therapy, similarly, how are these going to be effectively modified into a remote learning paradigm? And if they're not working, what is going to be the plan to modify them so that they do help your child in their learning? Then when we're thinking about hybrid blended learning programs, you have to think about everything that I just described. We really have to think about all of those, because you're going to have all of the pieces of the in-person that have to be considered, as well as all the pieces of the home learning. So you really have everything that everything in that blended program, as well as some special considerations for predictability. So this kind of goes into helping your child understand when are the home learning days, when are the in-school learning days, and making that predictable for them. So if you have the ability, if your district and your school is able to give you some choice in home learning versus school learning days, if you can chunk the school learning days together, that would be better, because then your child, it's not like every day is a surprise, but they go to school 2 to 3 days in a row, and then they're home and they have 2 to 3 days of home learning, and then that then falls into the weekend. So that can help with the predictability. You can offer a schedule, a visual schedule, and this is something you can also ask the school to help with, because this is specifically related to school, to make a schedule for in-person versus remote learning. To have a synchronous learning approach, so that you are very well guided on the remote learning days, and what the child is doing when at home is actually aligned with what they did in school, and it's not just busy work. So basically, what is really not appropriate is to have in-school learning days, and then on the remote days, there's just kind of a random assortment of worksheets. That's not going to be a good use of your child's time, and you may just get in disagreements with them because it may just really feel like busy work. So you want to make sure that home learning, those home learning tasks are actually aligned with what's being done in school. And then have, similar to the remote learning paradigm, have some expectations about where you're working with the teachers to understand what's expected of your child during that day. And then also within those expectations, thinking about, if your usual school day is 7:30 to 3 or 8 to 3, a child doesn't need, if they're at home, it may be sufficient to have 90 minutes to 2 hours of engaged learning time. They really don't need to be engaged in learning activities for 8 hours of the day. You have your priorities and the areas that they need to continue to grow academically over this next year, and work on getting those in the most efficient way, so that the day doesn't become too long and your child is just over it and really upset and bored by kind of what's happening, and you end up fighting with them most of the day about it. Have it condensed so that then you can move on to something that they enjoy a bit more. Okay, so if your child has an individualized educational program. This is, well, actually, to back up even before that, if your child has a diagnosis of autism, they qualify, or they should qualify for an individualized education program. Autism spectrum disorder is one of the disability classifications that is protected under the Individuals with Disabilities Act. That is a federal act that indicates that your child, because they have a, it's called a disability, and I know it's not a term that we particularly like, but it's a legal term that is used right now by that act, but it does indicate that they are entitled to a free and appropriate education. So now, one thing to keep in mind is that doesn't mean best, it doesn't mean optimal, but it does mean that your child is entitled to an appropriate education. That means that they are entitled to supports, modifications, and accommodations that allow them to reasonably access and make gains in an academic curriculum. So you can use in your IEP, your individualized educational program, that is your legal document. That's your legal document that says, this is what my child is entitled to by law to access the educational curriculum. You are a member of your child's IEP team, so you have the right to reconvene your child's IEP team at any time. You need to do it in writing. And you ask for, you want to have a meeting with their IEP team, and then you are allowed to request modifications at any time. I think that given that within this next year, learning is going to look very different. Most people's IEPs are not going to be, if you haven't reconvened with your team, most IEPs are not going to reflect accommodations and modifications and that may be needed during this next year. So I would think about, based on all the things that we just talked about what are going to be important aspects to prepare your child for in these various learning models, think about what are some things that would be helpful to be written into your child's IEP so that the school and the teachers are legally obligated to follow that out. Once you have it written in the IEP, they technically have to follow it. And if it's not followed, you do have the ability to take legal action and involve the support of an educational advocate or even a special education attorney. So these are things. So what this is going to look like though for each child is going to be a little different. But so if you know that if your child has difficulty with verbal learning, let's say your child is 8, but their verbal skills are more in line with, say, a 3 to 4 year old. That means that in a virtual learning paradigm, they cannot be taught, they cannot learn in a way where if somebody is on the other side is just talking to them at the level of their chronological age. There needs to be modifications and adaptions to support their verbal skills at where their developmental age is. And that might mean that they need more use of hands-on manipulatives, etc. So that would be something to talk to your child's school and their special education team about, and work with them to see what can you have written into that IEP that's going to provide your child with those appropriate supports and accommodations. It might mean that the school is preparing those materials for you in advance and then offering a time where you can go and pick them up so that your child has physical materials and is not being asked to participate 100% verbally via screen or complete activities on a screen. So that's one example of something that could be done. And then another thing to be aware of are compensatory services. So this is something where you do have a right to request for additional services in the future if your child's school fails to provide a free and appropriate education. All right, so let's move on here to some of the important, and I know I'm gonna go through these a little bit quickly then also so we can get to the questions and discussion. So we know that if your child is going for in-school, in-person learning, they're going to most likely need to wear a mask. This wearing a mask can be a skill that needs to be taught. It might not be something that your child just is automatically okay with. So first you want to think about choosing the right kind of mask, having a comfortable fabric, something that's appealing, and then comfortable ear attachment. So here are some examples of what I've seen. Kids who have especially some difficulty with sensory processing, and if these masks can be very sensory aversive to them, having masks that have ties to them, or the button extension so that it's not looping around their ears, or an extension like one of these hair barrette extensions, those may be helpful for getting your child to wear a mask. Now, it might not be though that your child will immediately wear a mask. You may need to gradually work up to this, going from having the mask just out and available to touching it to your child's skin, to putting it on for just a few minutes or just a few seconds, to then wearing it out somewhere. You'll want to make sure that you're modeling this at home and it's part of everybody's routine. So something that has worked well for some families who I've worked with is having hooks by your door where everybody hangs their mask up there. And before you go out the door, as part of your routine, after you have your shoes on and you've got your bag and everything you need, you put your mask on before you go out. Also pairing it, if your child is very resistant to wearing the mask, pairing it with some rewards. We know preferred activities on screen time can be very rewarding. So use it to your advantage where if your child wants to watch a YouTube clip, they've got to put their mask on first. And once they've got their mask on, they can watch one YouTube video and then they put the screen away and the mask comes off. And then you kind of build up from there. Then they have to put the mask on, they have to do something else, and then they can watch the video and then the mask comes off. So you're putting the reward at the end and you're building up the time and tolerance for them to wear the mask. You want to start really gradual and make sure that you're offering those rewards at each step. And then, as I had mentioned, making sure that it's part of everybody's daily routine. Now, when you're thinking about supporting your child's behavior, all the things that we know that work for children who have autism and related neurodevelopmental disabilities, all of those things still apply. And this is something, if you have special education teachers and behavioral therapists involved in your child's care, this is something that you can discuss with them on how to individually use these for your child. Kids who I work with, we see that antecedent control works so well to prevent so much. And we want to really work on the prevention side, because if we can prevent uncooperative behaviors or disruptive behaviors or a child becoming really upset, that's better. Because also then they're just happier to engage in what it is we're asking them to engage into. So when we're thinking about antecedent control, we're talking about routine and structure. So the child has some predictability and they know what is being expected of them. Very clear expectations, putting it in a visual format through a social story can help kids understand what it is they're supposed to be doing. And then any kind of visual supports like schedules, first then boards, and using work systems, which I'm going to show you a picture of that in the next slide. Those can be very helpful to make it very clear to the child what it is that they need to do. And then using positive behavioral supports. This is a lot of labeled praise, saying what it is that you like that the child did, having a token or point system, tangible rewards, and then the use of the PREMAC principle. The PREMAC principle is really just a fancy word to say, do what you have to do before you get to do what you want to do. So pairing, don't start off the day with screen time or with TV or an iPad game. Save that, save Minecraft for the afternoon after they've done the things that they have to do. And then employ meaningful consequences. So screen time, again, is a big motivator. So if they're not doing what they're supposed to do and it's very clear what is supposed to be done, they lose screen time, have an extra household chore. I've had a child who I work with who has to, I was talking to the parent the other week and she had said if he doesn't do something, if he purposefully doesn't follow a direction, like he's not supposed to be on a screen and he goes and sneaks the iPad and is kind of playing in the closet on it, then he has to clean a toilet. So, and because mom picked that as the consequence because she said, that's something that he really doesn't want to do. And so it worked. It resonated with him of, all right, I'm going to leave that. I'm going to follow mom's direction around the limit setting on the iPad because I don't want to have to do those. I don't want to do those household chores. So I'm not saying that this is the necessary consequence that would be appropriate for your child, but just saying this was something that a parent had told me last week and it worked. It was working well for them. And then make sure that you have some time for physical activity. I know this is hard with the reality of the situation right now, but also a lot of challenging behavior can be prevented and kids can be better regulated just by having more time to be outside and be active. Now this is some of the work systems I was mentioning before. So up here in the upper left-hand corner, this is how you would use a structured work system where you have the work that the child needs to do over on this side. They work from left to right. So this, you would put the things that they have to do here. They sit at a desk, maybe facing the wall so that there's less distractions. And then when they're done, everything goes into here. So they can clearly see the progress they're making through the work, and then they know when they're done. And then this is an example of something that you could use here, where it's very clear. If your child needs to do 3 worksheets, you have 1 in each bin. And so they know very clearly what they have to do to start, what they have to do to finish, and they know when they're done. So this can just help break things down in a way that facilitates their engagement and cooperation. And then of course, using first then, I have charts to show that something they enjoy will follow something that they have to do. Then when we're thinking about social skills, we have lots of structured social skills curriculums. These have since, the reports that we had from families initially in that initial data collection from the schools, they weren't reporting great satisfaction in the social skills training, but I think this has changed over time, because I will say as we've gotten better with adapting programs into a virtual format, kids also seem to be enjoying them. So we have one, for example, that just started over the summer at our in our medical practice for adolescents who are working on, we're working on social skills, social emotional skills, and the kids have really loved the group. And the virtual format is working great for them now, and they're able to continue on with it through additional modules that we're developing. So as we've gotten better as a field at adapting these, I think also kids are benefiting from them more. So look into what's available for that in your school, in your local area, and then really enlist the support of teachers and the paraprofessionals. So this is a perfect thing that can be written into an IEP and adapted into a virtual format. This is something that a para can do. A para can work with a child one-on-one using a structured social skills curriculum, or under the guidance of a BCBA, using a structured social skills curriculum to work with your child virtually to keep them engaged in building their social understanding skills and their conflict resolution skills. So they may not be able to work on things like nonverbal social communication as easily virtually. So things like eye contact, gestures, range of facial expressions, and using those communicatively, but they certainly can work on other skills. Set up virtual play dates when you can and have those facilitated. This is another way to use some of your services that are in your IEP, and then some of your private services. And then also organize, when safe and appropriate, organize play dates in a safe space, like outside when you can. This is just an overview of what we have at our center as an example, but I don't think we had a lot of New York families on the call, but we do have research programs and clinical programs. Our research programs have no cost evaluations as part of the research study, evaluations that can be used for a variety of purposes. And then in our clinical program that's in our medical practice, we have evaluation and diagnostic services, individual and family-oriented treatments, and social skills groups. We're providing in-person, telehealth, and hybrid services depending on the needs of the child and the family. And then we have parent and practitioner resources available on our website and Facebook page. If there are any New York families who have joined the call, we do have one study. If you have siblings who younger siblings who you're concerned about, you're concerned that they might have be showing some delays in their social communication or maybe showing signs of autism, we do have an NIMH funded study right now that is looking at toddler age children, and you do get evaluations, free diagnostic evaluations, as part of participation in that research study. So if that's something that anybody who is local and interested in, this is the information for that. And then this is a list of resources that will also be provided to you. There's a number of videos in here that will go more in depth in terms of each thing that I talked about today, as well as some additional guidance around various supports and centers that you can enlist for your child's care. All right, so let's move on. Let's move on to our questions discussion here. Let me just end show and stop my sharing. All right. So let's see. Oh, and I'm sorry, and we're right. Our time.
So we do have a few minutes for questions, and we've gotten a few that have come in. One of the, and I know that you probably covered this, to some extent in what you were doing, but one of the questions that came in was how do they prepare their child slowly to become more independent on the work that they're doing? Because I'm cognizant of the fact, and this parent is a really great example, that parents are still also working from home. So they're managing their own work as well as helping their children. And as you said, a lot of the work that you do is hands-on. And I think a lot of those children are used to that hands-on work and that attention in order to get them to focus. So what do you recommend for building that independence as the school year approaches?
Yeah. Well, I would work first with your child's teacher to understand what is the most minimal amount of work that can be done to still work towards the goals, to basically make sure that you are cutting out all of the busy work, because just nobody has time for that, right? So cut that out. Make sure that what they're being asked to do is very aligned with their academic goals for the next year. Then I would consider a work system. So a work system, look up, actually I'm going to provide another resource link for ways to use structured teaching and various forms of structured teaching. I would work on teaching your child how to use a structured teaching work system, because that does really promote a lot of independence. And once they're independent with that, that can make things a little more hands-off for you so that you can do something else while they're finishing that, and then you go back and check it. And then I would use some positive behavioral supports, so some rewards and incentives for completing work well. So if a child does it with minimal errors, because sometimes your kids are just going to rush through things to get it done, to get to the other thing. Reward them for doing the work well, so that they are incentivized to pay attention to what they're being asked to do and to do it independently and to do it well. But this is one of the very challenging realities of this next year that really does not have a perfect solution. The other thing that you can ask for is for some, and I think this is going to vary a lot by district, but you can ask for some in-person instruction from somebody from the school who can help more with that. The other thing to consider is if you have access to OPWDD services, so things like respite support. So there are, in a number of states, children will qualify for state-funded respite services. Those should be, at least in New York, they are also reopened to be provided in person, just to give you some additional help and oversight on your child's education, on your child's schooling, so that you can balance the dual responsibilities.
Great. Thank you, Dr. Martin. Another question that came in, and for anyone that has any lingering questions, please do put them in the chat function, whether you're chiming on Facebook or via Zoom. Another question was just about those rewards and that motivation piece. There's obviously, I think, this is going to be every day. And so they're worried about just kind of giving the iPad every day, and then the reliance on that, and the same thing that it will lose its appeal. I mean, I don't know many children that lose the appeal of iPad, but this is just a question that came in, because obviously they might want to diversify the different rewards they're giving their child. How do you recommend them going about that and adapting on a day-to-day basis, if that's the way they're motivated?
So I'd start with making a list of all of the things that are highly motivating for your child, and really use everything. Favorite, including, I'm not somebody who's I'm actually pre-COVID, I'm not a proponent of screen time or edibles. So this is like, it's really bad times that I'm saying employ these strategies. I'm like, pull out everything, but think about really rewarding types of snacks and foods, as well as all of the things that are very rewarding, like what is it that they like to do on the iPad? And then think about things outside of that too. Are there other kinds of activities that are similar in motivation, that they're similarly motivated to do and enjoy independently? List all of those things out, and then see how much you can break them down. So if your child likes, for example, M&Ms, have them work towards, don't give them a whole pack of M&Ms for doing something, but have a system in place where they are earning 1 or 2 M&Ms after a certain amount of time, or they're earning 1 YouTube video after something. So they're not doing something and then getting the iPad for 4 hours, but they're getting 1 thing on the screen for doing a certain thing. So I would think about breaking it up that way. And initially it's going to be a huge pain. Like you're to get kids initially to do that, it's usually a big fight, and they're going to want more and everything. But if you stay consistent as humanly possible in this challenging situation, they will adapt to your expectations. So if it's clear that you've got to do this to get that 1 video and then it's going to go off, then as long as you stay clear on that,
because you have masks
for the next one to do it again to get another video.
Okay, that's great. Thank you, Dr. Martin. And then lastly, I know that parents are actually experiencing a lot of anxiety leading up to what's going to happen in the next few weeks, whether it be, I know someone in the chat said that there's an option to go in person, but they're having their child at home. And so some will be going in and out. And there's a lot of different changes. So there's concerns about different meltdowns and how their child might react. How would you do you have any advice for parents on how they can take care of themselves during these times and mentally prepare themselves as well as their families for what's to come in the next few weeks?
Yeah, I think it's hard. And I really wish that I had an easy answer to that. And I think this is, as we're seeing, this pandemic is really disproportionately affecting parents and families who have children with special needs. And so you are in the hardest, most stressful situation of anybody dealing with this pandemic. And so I think know that what you're coming up against is shared by the majority of families who also have children with special needs. And then knowing that you're the car driving this. So as you know, when your gas tank gets low, if there's not time to fill it up, everything else is going to stop. And so this might mean getting as creative as possible as you can in coming up with ways to get yourself a little bit of relief. And this might look very different than it usually does. So even something like 10 minutes of uninterrupted time to take a warm shower. That might be the little boost that you need in the morning to be able to then deal with the next 2 hours. So think about taking it day by day and sometimes hour by hour. And as much as you can, possibly try not to think about what's going to happen in 3 months, because the reality is we don't know. And thinking about it too much isn't going to help us. It's just, it puts us in a rocking chair where we're going to rock on it all day, but it's not going to get us anywhere. So as much as you can, try to pull yourself into that mindset for the present and think about what can you do in the next day, in the next hour, maybe even in the next 5 minutes to get yourself a breath, to recharge momentarily, to come back to the situation. And know that your kids are going to be stressed too. And kids are going to regulate with us. So when we're stressed, our kids are going to be more stressed. And as much as you can, in the presence of them, to just try to take that breath and remind them, like, we're in this together. This is stressful. We're going to be okay. And we're just going to move slowly through this and think about this is what also reaching out. I know right now schools are in a hard position because they're also dealing with a lot in terms of trying to figure out how to open, but going back to them, knowing that you do have some legal protection with that IEP plan, going back and talking to them about what you need to be able to make it through those moments over this next year and what they can do to help support you and your child to do that.
Fantastic. Thank you so much, Dr. Martin. I mean, on that note, the American Autism Association will continue educational resources and workshops for and please know that we're here to help you as well as for the many other resources that you rely on. I'd like to thank Dr. Martin and the child for working with us today and providing such an informative webinar. We really, really are grateful for your time. We will be sending out all of the resources and information to people, as well as Dr. Martin's contact details. So if you have any follow-up questions, please don't hesitate to reach out. As I said, we're all here to help you. So thank you so much. Wishing everyone the best of luck in the upcoming school year, and we hope to see you all soon. Stay safe.